Yeah, so Dr. VS, be honest with me. I think I want a tummy tuck. I do. I think I want a tummy tuck. I've thought about it for a long time. I don't think I have that much skin laxity. I would even want a facelift, but I know that I'm 31 and I probably shouldn't have a facelift. Treat me like I'm your patient. And what do you think? Like, what do I need to be a good candidate for something like a facelift or something like a tummy tuck? Yeah. I feel like they have some qualities that are similar for being a good candidate for it.
Yeah, great question. I mean, so some people come in and say, look, I'm 75, I'm 90 years old. Like, am I too young? Am I too old? Really what it comes down to is, are you medically ready and are you medically optimized? And your health is the most important part of this whole journey. So obviously we want to do a safe operation. That's our priority. And to get you prepared, we have you visit with, relevant specialists like your primary care. We get some labs before surgery. Sometimes you need things like an EKG, like a little heart assessment. Or if you have medical complexities, then you see your specialists. Some people are on blood thinners. Some people may have asthma. So we want to make sure that you're ready for surgery. That's the most important priority.
That's like the first key.
Step number one, yes. So someone who is younger with a lot of medical problems may actually be a higher risk than someone who's older with like no medical problems, who's like running marathons and active every day. And so really it comes down to like your heart and lung health, your overall medical complexity. So I think that's the first step. Okay. But we make sure everyone is medically ready before proceeding with surgery.
But then at the time of the consult, how do you determine that someone is like, because we were just talking about blepharoplasty and how sometimes it's not about the eyelid, right? Sometimes it's about the brow position.
Right.
So how do you determine if someone is good for a facelift or neck lift, a tummy tuck, lipo? I remember when I had a body contouring, my surgeon did a lot of pinching and poking and looking, and he really wanted to explain to me, not everyone is a good candidate for lipo, which I was kind of shocked by. And I think a lot of people are, because you hear lipo and you think everybody can have lipo. Understand, I recommend lipo for everyone. I think it's a godsend. But some people are better candidates for it than others. And so with this conversation of fads and things that are popular, I mean, people are getting facelifts at like 30, right?
Yes,
so I'm curious to know from your perspective during our coffee chat,
what
would make someone a good candidate for something versus not, and like what are some alternatives to something like a facelift or a tummy tuck?
Yeah, so during the consultation, besides the medical safety, is also what are you looking for? What aesthetic result do you want? And what bothers you? So I always start the conversation in a consult with like kind of what bothers you, because what your doctor or a friend or family member may perceive as something may not be something that bothers you. And so the priority is always yourself. You put yourself first. You have an open conversation with your medical professional and just say like, hey, this is like what bothers me. Now sometimes that opens up the conversation to say, well, you may come in for concern of the abdomen. You may not be the best candidate for only liposuction because of reason XYZ. And that could be you have too much skin laxity, your muscles are separated. And so that may introduce, an additional operation, which could be, yes, we can do liposuction for the flanks or the sides of the abdomen, but also you would be a better candidate for something called a tummy tuck, for example. So a tummy tuck is also known as an abdominoplasty, which then results in plicating or suturing together your six-pack muscles, and then also reducing that gap between the muscles. So that's one step. And then two is removing the extra skin and fat that's on the abdomen.
And you've actually had patients come in who thought that the solution to their problem was lipo.
That's right. Yeah.
And you had to be like, well, I think lipo here is good, but then we should combine it with a tummy tuck.
Definitely. And so really it comes down to like, if the patient says, yeah, I want to improve the appearance of my abdomen, then we can have that whole conversation about like, well, I think you'd be a good candidate for this procedure or surgery because of this reason.
Okay.